The topic is investigations in gynecology. What are the various investigation modalities that are available in gynecology? First is ultrasound. Ultrasound is of two types, either trans-abdominal sonography और ट्रांस-vaginal sonography. ठीक है, अल्ट्रासाउंड दो टाइप का हो सकता है, ट्रांस एब्डोमिनल और ट्रांस विजाइनल. देन वी हैव SIS, that is saline infusion sonography. So in this we infuse saline in the uterus so that the interior of the uterus is easily visible. So this is SIS, saline infusion sonography. Then MRI, CT scan, PET scan, hysterosalpingography, HSG. HSG stands for hysterosalpingography. Then hysteroscopy and laparoscopy. So these are the investigation modalities available in gynecology. First is ultrasound, which is of two types, trans-abdominal or trans-vaginal. Then saline infusion sonography or SIS. Then MRI, CT scan, PET scan. See, PET scan is the investigation of choice. It is the investigation of choice for nodal metastasis in ovarian cancers. So PET scan is the investigation of choice for nodal metastasis in ovarian cancers. Then HSG, that stands for hysterosalpingography. See, HSG is basically the investigation of choice for tubal patency, to know if the fallopian tubes are patent or not. For that, the investigation of choice is HSG. Then hysteroscopy and laparoscopy. So these are the investigation modalities. We will study them one by one. First is ultrasound. So ultrasound is non-invasive. It is safe in pregnancy, and with the help of ultrasound we can see the exterior as well as the interior of the uterus. Okay, we can visualize the endometrial thickness and we can see all pelvic organs through ultrasound. Okay, so ultrasound, it is non-invasive, it is safe in pregnancy. अल्ट्रासाउंड में हम यूटरस का एक्सटीरियर इंटीरियर दोनों देख सकते हैं. We can visualize the endometrial thickness with the help of ultrasound and all the pelvic organs. Ultrasound is non-invasive, safe in pregnancy. एक्सटीरियर इंटीरियर दोनों विजुअलाइज होता है यूटरस का. इसके अलावा यूटरस एंडोमेट्रियल थिकनेस विजुअलाइज हो सकता है और बाकी सारे पेल्विक ऑर्गन विजुअलाइज होते हैं. So there are two types of ultrasound, trans-abdominal and trans-vaginal. Let's see the difference between them. So full bladder is a requirement for TAS. Trans-abdominal sonography का requirement है full bladder. ठीक है, TVS के लिए full bladder is not a requirement, but trans-abdominal sonography के लिए full bladder is a requirement. Trans-abdominal sonography में the frequency of wave used is 3 to 5 Hz, and trans-vaginal में it is more, it is 5 to 10 Hz. Trans-abdominal में 3 to 5, trans-vaginal में 5 to 10. Trans-abdominal कब करते हैं? When the uterus is palpable per abdomen. ठीक है, तो trans-abdominal sonography का indication क्या है? When the uterus is palpable per abdomen. If it is not palpable, then we do trans-vaginal sonography. ठीक है, तो trans-abdominal कब करते हैं? When the uterus is palpable per abdomen. Otherwise we do trans-vaginal sonography. ठीक है, and one thing which we have to remember is when frequency is more, frequency of the ultrasound wave is more, then the resolution is better. Frequency of wave is more, then resolution will be better, but the depth of penetration will be less. ठीक है, तो अगर फ्रीक्वेंसी ज़्यादा है तो रेजोल्यूशन बेटर होगा, पर उसका डिसएडवांटेज क्या होगा कि डेप्थ ऑफ पेनिट्रेशन विल बी लेस. ठीक है, तो ट्रांस एब्डोमिनल में कितना फ्रीक्वेंसी था? 3 to 5. ठीक है, 3 to 5 हर्ट्ज. तो यहाँ पे फ्रीक्वेंसी कम है तो रेजोल्यूशन कम होगा, पर डेप्थ ज़्यादा होगा पेनिट्रेशन का. ट्रांस वैजिनल में कितना फ्रीक्वेंसी है? 5 to 10 हर्ज। तो यहाँ पे फ्रीक्वेंसी ज़्यादा है तो रेजोल्यूशन बेटर होगा, फ्रीक्वेंसी ज़्यादा है तो रेजोल्यूशन बेटर होगा, बट डिसएडवांटेज क्या है कि डेप्थ ऑफ पेनिट्रेशन कम होगा। This is how a uterus looks on the ultrasound. This is normal uterus on the ultrasound. See, this white line is the endometrium. White line is the endometrium. This white line is the endometrium. Then we have the myometrium. Okay, rest, this whole is the uterus. Okay, and then this one is the myometrium. Okay, so the white line is endometrium. Endometrium appears like a white line on ultrasound. So this is the normal ultrasound of a uterus. This is the normal ultrasound of a ovary. These are the unruptured follicles. These black color areas are the unruptured follicles. These are the unruptured follicles. Okay, so these black round color things are the unruptured follicles, and the applied aspect is that if there is more than 20 unruptured follicles, that means it is diagnostic of PCOS. So PCOS means the unruptured follicle will be more than 20. Earlier the criteria was more than 12, but now the new criteria is that if the number of unruptured follicles is more than 20, that means it is PCOS. Let's see the uses of ultrasound. So ultrasound is the first investigation for any pelvic pathology. Okay, so it is used for the overview of pelvis. So ultrasound is the first investigation for pelvic pathology. It is also the first investigation for uterine pathology. If you are suspecting fibroid, polyp or adenomyosis, then the first investigation is ultrasound. It is the first investigation for AUB, that is atypical uterine bleeding, and also Mullerian malformation. So Mullerian malformation, it is a coincidental finding. Okay, Mullerian malformation is a coincidental finding. We are doing ultrasound for something else, and then in that Mullerian malformation is detected. So Mullerian malformation is basically a coincidental finding, and the investigation of choice for Mullerian malformation is 3D ultrasound, not the usual ultrasound. The investigation of choice for Mullerian anomalies is 3D ultrasound. Mullerian anomalies के लिए 3D ultrasound is the investigation of choice. Mullerian anomaly is basically a coincidental finding on ultrasound. The investigation of choice for Mullerian malformation is 3D ultrasound. And ultrasound is the investigation of choice for measuring endometrial thickness. It is also the investigation of choice for fibroid. So ultrasound is the investigation of choice for two things. First one is fibroids, and then if you have to measure the endometrial thickness, then also it is the investigation of choice. Let's see the drawbacks of ultrasound. So TVS, transvaginal sonography, is difficult if the vagina is narrow, okay, which we will see in virgin females or post-menopausal females. So TVS is difficult if the vagina is narrow, for example in virgin females and post-menopausal females. So in virgin females we do not do TVS, and it is difficult to do TVS in post-menopausal females. Why? Because the vagina is narrow. So this is the drawback of ultrasound, basically of TVS.